You're listening to the Dental Zone podcast. I'm Dr. Rachel Hall. This is the place that supports you to understand your dental issues, the causes and how to prevent them, empowering each individual to get the most out of life while bearing a stunning smile. Hello and welcome to the Dental Zone. I'm Dr. Rachel Hall. This is our first episode. And I am an holistic dentist. I have over 30 years experience. I work out of my practice in Kenmore in Brisbane. Today's show, I want to explain to you what a holistic dentist is, what we do and why we do it. But first, let me tell you a little bit about my background and how I've ended up being a holistic dentist and doing what I do today. Now, when I graduated, I was trained conventionally and I worked as a National Health Service dentist for 8 years as I was born, bred and raised in the UK. We were seeing about 40 patients a day, churning out dentistry, really exhausting, quite hard to work that way. I was placing a lot of amalgam mercury fillings and just doing what I was trained. And it was when I moved to Brisbane for a change of lifestyle that I found myself in a holistic practice. And this is where I developed my passion for holistic dentistry. And I've worked that way for the last 16 years. For the previous 12 years, I've had my own business and I've learned a lot during that time about myself, about human nature, people, health and well-being, and also about dentistry. And I feel it's a real great opportunity to be able to share a little bit of my knowledge. And I'm going to start with some of my story and my background. So when I worked for the holistic practice, they were great people and I really liked them and I enjoyed working there. So seeing as they wanted me to work a certain way, I was happy to do that. But what I realised in about 6 months to a year is that my own health and energy levels and well-being had started to improve because I wasn't handling so much mercury fillings. I also saw changes in my patients that I couldn't really explain, and I'd be saying to them, what is it you've done? What's changed? You're looking really well and your health's improved. Tell me a little bit more about that. And their answer would be very commonly, you removed my mercury fillings. And I was quite surprised and a bit taken aback by that. And I was like, surely there's more. And they're like, no, you removed my mercury fillings. And we were doing that in a way that was following safe guidelines and protocols to protect the patient from mercury exposure and to protect myself and my team as well. Lovely to see some people joining. Hello, Monica, all the way from Germany. Hello, Yasmin. Thank you for joining me this evening. So that change in people's well-being and in my own, which I couldn't explain because I hadn't changed my lifestyle. I was still working very hard, long hours. I was still exercising to extremes. I wasn't really taking great care of myself, even though at the time, if you'd have asked me, I'd have thought I was healthy, yet I looked back and I was drinking a lot of coffee to keep me going. So I started to put some of the pieces of the puzzle together and go, could there be more to this way of doing dentistry than I've given consideration? So during that time, I started reading about mercury and its impacts on health and well-being, fluoride, diet, nutrition, sleep, relationships, stresses, environmental toxins, chemicals, and the energy that we store within our body. And it all started to make sense to me. And the more I researched about dental amalgam, the more I was convinced that I shouldn't be using it and that holistic dentistry was the way for me. So what is holistic dentistry? Well, essentially, if you walked into my practice, it looks pretty much like any other dental office that you'd be in out there. It's got chairs, it's got drills, yes, I know, and all those dreaded instruments that seem to make people nervous. And so from the outside, it looks like we're doing the same thing. We're doing hygiene appointments, we're doing checkups, we do x-rays, take photographs, we do diagnostics, we remove decay, we fill teeth, we rebuild teeth, and so forth. But it's our philosophy that's different, because we believe that your mouth and your body is connected, which it is. I mean, it's part of the same thing. You can't say that your heart is a separate piece of your body because it's not. So what goes on in your mouth has an impact on your overall health and vice versa. And we feel as holistic dentists, it's our role to explore that and help you and us understand why we get tooth decay, why we get gum disease, why if our overall health is bad, our dental health will be bad, and what impact having dental decay, gum disease, infections, inflammation, misaligned bite, jaw problems and breathing problems can have on the rest of the body. And by exploring these avenues, we can create a prevention package for people. We can help them to make changes in their health and well-being so that they're empowered to look after themselves and take better care of their health, as well as teaching them about the fundamentals and basics of looking after their teeth. So when I graduated, I was told, if you don't brush and floss and you eat too much sugar, you're going to get tooth decay. And I think everybody, if you ask them what causes tooth decay, would say sugar. And that's a common agreement. But it seems that there's more than that. And so I'm going to go into that in a little bit more detail. But if you're enjoying what I'm sharing so far, then please press the hearts button, give us some love. Facebook likes that. And if you want to, I'd really appreciate you sharing this so that more people can hear the message. So one of the fundamentals is that you taught sugar, lack of flossing, lack of brushing, tooth decay. Yet what I was seeing was patients who had really clean mouths coming in with a new cavity, coming in with yet more decay, coming in with problems, and we just couldn't make sense of it. We'd look at their diet, look at what they were eating, look for hidden sugars, even looking for acids, soft drink, anything that was causing erosion like reflux, and so forth. And we just couldn't put the pieces of the puzzle together. Then we started looking at areas in their life like their sleep, their stress levels, what their background was. Had they been exposed to chemicals and heavy metals in their lifetime, and that sort of thing. And what we realised is that people with high stress and high exposure to toxins were much more prone to tooth decay and gum disease, despite the fact that they were cleaning well and doing all the things that they were told they were supposed to do to prevent cavities. So it made me appreciate that changes in our health and well-being, our stress levels, are impacting on our dental disease, and that it must mean that if that's going on, our dental disease is impacting on our body. So if we've got poor dental health, if you've got broken, decayed teeth, sore mouth, it's going to make it hard for you to chew. It makes it difficult for you to smile and be social. It can be embarrassing and painful. And so when we don't eat the right sort of foods, that will impact on our nutritional status, and we end up being malnourished. But also being malnourished, which is what we have with our current modern day diets, which is called the Standard American Diet, or SAD, which really sums it up well, is that we're eating a lot of refined and processed foods, we're having too much carbohydrate, we're not getting enough vital nutrients, optimal minerals and good fats to take those things where they need to go. So even though we're ingesting a lot of calories, we're not getting nutrition. So we can have people who are healthy weight or overweight and they're actually malnourished. Now, if you're not getting all the minerals and nutrients and vitamins that your body needs, it's going to start taking it from elsewhere. So if you're low in calcium, magnesium, for example, and your body's acidic because of that, it's going to start drawing those minerals out from your teeth and your bones and into your bloodstream to be able to rebalance things. And if those minerals are being stripped away because you're acidic, that is going to increase your risk for tooth decay. Forward is to help that patient not have more dental problems. So we do regular maintenance for their gum health and regular checks to ensure that everything's on track. And we support them to find good GPs, naturopaths and nutritionists if that's the way they want to go. So we have a dual role. We have a role where we're fixing teeth, treating disease, and we have a role where we're educating people. And that's why I want to do this series of Facebook Lives, so that we can start getting the message out and helping people to know what's going on in their mouth, why it's going on, and what they can do about it. What we've realised in dentistry, and this is becoming more and more mainstream with research, is that smokers are more prone to dental disease. People who have too much sugar, that's a given. People who drink alcohol will also be more at risk for dental disease and oral cancers. So we understand that our lifestyle impacts on what's going on in our mouth, but also what's going on in our body. But there's also been studies showing that if people have got gum disease and dental disease, they're much more at risk of heart attacks, heart disease, strokes, diabetes, certain types of cancers, having low weight births, premature labours, finding it hard to conceive, and even links to things like Alzheimer's and dementia. So taking care of your mouth goes beyond having fresh breath and a nice smile and being able to chew the foods that you like. Hey Simon, thanks for joining. It goes hand in hand with looking after yourself. So if you want to have a healthy body, you do need to have a healthy mouth. It's also important that if you do have any pre-existing illnesses like diabetes, that your gum health and your dental health is really well maintained, because if you've got gum disease, it's actually really hard for you to regulate your blood sugars, and your diabetes is much harder to manage. So please don't take for granted what's going on in here, and that it's not just for kissing and smiling and talking and singing, that there's far more going on in your mouth. And the mouth to me is a window to the health of the body. By looking around your mouth, I can tell a lot about your health and well-being. I can tell a lot about what's going on and how to support you to better manage that, not just to prevent decay, but to keep you living a long, healthy life. So that's why our tagline or our business mantra, or the way we think about things, is that we talk about filling years and not filling teeth. So we want to help people fill their years and live a really good, productive, happy, energetic life, and not be just focusing on filling their teeth. And resolving dental problems as they arise. Most dentists, it's oh, look, you've got a hole, let's fix it. Oh, you've got gum disease, let's fix it. And there's never really very much discussion beyond brush, floss, don't eat sugar as to why you're having dental disease, why you're having bleeding gums, bad breath, sore teeth, why your teeth are breaking, why your fillings aren't lasting. As an holistic dentist, it's our role to help you understand what's going on, to look at prevention, to look at the underlying and systemic reasons as to why people get tooth decay and dental disease, and not just be focusing on fixing the problems. It's my goal in my practice to get your mouth healthy again, to get things back on track, and to keep things that way. And I believe we can only do that if you have a healthy body and a healthy lifestyle and are fit and healthy for life. And that is the whole purpose of the Dental Zone podcast, is to empower you to understand the relationship between your health and wellness and your oral health and your dental health. Holistic dentistry goes beyond the average checkup and clean to help provide you with everything that you need to live a long, healthy life with a beautiful smile. So thank you very much for listening. I'm Dr. Rachel Hall. This is the Dental Zone podcast. Please join me for the next time round. And in the meantime, get in the zone. You've been listening to the Dental Zone podcast with Dr. Rachel Hall. For health, lifestyle, fitness, and a great smile, get in the zone.